Hello, and welcome to another episode of the Med School Minutes Podcast, where we discuss what it takes to attend and successfully complete a medical program. This show is brought to you by St. James School of Medicine. Here is your host, Kaushik Gua.
Thank you for joining us, and welcome to another episode of Med School Minutes, where we talk about everything MD related with the focus on international graduates, specifically Caribbean students. Today we have a very special guest, Dr. Rob Kimmel. Dr. Rob Kimmel is a student and graduate of St. James School of Medicine, and he is a plastic surgeon. And we wanted to talk to him a little bit about what his experience has been like. So without further ado, let's welcome Dr. Rob Kimmel to our program. Thank you so much for joining us, Dr. Kimmel. We really appreciate your time today. So without further ado, why don't you tell us a little bit about your background?
Yeah, thank you. I'm happy to be here. So my name's Rob Kimmel. I am a St. James graduate. Kind of going back a little bit before that, I'm from the U.S., originally from Pennsylvania, and I did my undergraduate studies at the University of Vermont up in Burlington, Vermont. I took a little bit of time off between my undergraduate studies and pursuing an MD at St. James, and I graduated from St. James School of Medicine, the Anguilla campus, in 2016, so the spring of 2016. I then pursued a general surgical residency. So I matched into a general surgery residency program at Waterbury Hospital in central Connecticut. It's since changed names. It's actually the Frank Netter School of Medicine via Quinnipiac University, but it's a general surgery program in central Connecticut. And I completed my 5 years of general surgical training and wrapped that up in 2021. And in the fourth year of my general surgery training, I matched into a plastic and reconstructive surgery fellowship at University of Tennessee Health Science Center, which the only plastic surgical independent program that exists with University of Tennessee is in Chattanooga, which is where I reside now. I'm in the second year of my plastic surgery fellowship and am pursuing a career, and seeing the light at the end of the tunnel here with a plastic and reconstructive surgery fellowship. So that's where I stand
awesome.
right now.
So is it fair to call you a plastic surgeon now, or would you call yourself a plastic surgeon after the fellowship is over?
That's actually a great question. I kind of more comfortably prefer to call myself a fellow and a plastic surgery fellow, and generally that's how we're referred to.
Okay.
If you want to get technical, we call it a residency here at University of Tennessee, but kind of across the nation, it's termed a fellowship. And there are multiple ways to get into plastic surgery. There are integrated paths. That wasn't really my route, but there are independent paths, which is what I'm in right now. And I consider myself a plastic surgery fellow, and it's a 3-year program, and I'll be finished in technically, I guess, June of 2024. So a little over a year and a half from now, and I plan to then go into practice.
Oh, okay. So considering we talk so much about the fellowship, there seems to be a lot of questions surrounding fellows and fellowships in general. So the biggest one being, like, every time we talk to students, or I talk to a student, they're like, oh, after my residency, I'm done. I'm never studying. So what motivated you to get into a fellowship?
Yeah. So you do hear that, and it's a long road. I mean, there is absolutely no doubt about it. I think medical school, St. James in particular, but just generally, it's a difficult path. And when you start as an MD1 and work your way, up the ladder, you have to know going into it that you're going to have to put a lot of time, a lot of effort, and a fair amount of responsibility. I mean, I think a lot of that just goes without saying. But it was what I wanted to do most. I had a fantastic experience in my general surgical residency, and I really enjoyed the training that I got. I was in a great program, a very IMG friendly program.
Okay.
And when I was training in general surgery, it had crossed my mind many times to finish my general surgical training, become board certified in general surgery, and pursue a career as a board certified general surgeon. But during my general surgery training, I got some exposure to plastics, and I did a lot of breast reconstruction and some cosmetic as well as some facial reconstructive cases. And that's what I found to be the most engaging, the most challenging, and really what kind of motivated me the most. But regardless of where you do your residency and what you do it in, if there is a subspecialty that you're interested in and you're willing to just put that extra bit of work in, I think it's as important as it can be, because you want to be, interested and engaged
Mm-hmm.
and enjoy your work.
Right.
And I get that opportunity even as a fellow here at University of Tennessee. So, the
Wow.
other thing I'll say is to young medical students that are just starting and they kind of are thinking about residencies. There is absolutely, no mark or, nothing negative about finishing a residency and going into practice. I think that's fantastic. And in fact, we need it. It's extremely important. But if there's something that, you want to pursue from a little bit of a higher education, whether it be another year, 2 years, 3 years, go for it. It'll be
Okay.
worth it.
So typically, a surgery residency is 7 years, or are there residencies that are possibly shorter?
There are absolutely residencies that are possibly shorter. So
Oh, okay.
mine was a 5-year residency.
Oh,
So
okay.
um, it varies, and they'll be very upfront with you when you're
Hmm.
applying for residency to kind of figure out and to know what the timeline is. A lot of surgical residencies do ask of their surgery residents to do a year of research.
Okay.
And so that will, by nature, make it a 6-year residency. Some
Okay.
ask for 2 years, and others, like mine, which I had kind of gone seeking because I've never been a super, research heavy person, just in my own kind of
Hmm.
nature. Um, I wanted a 5-year surgical residency where I could do some research while I was training and not have to add an extra year. Um,
Okay.
and general surgery in general is a 5-year program, but programs vary from place to place and the type of setting it is. And in a more academic setting, um, you tend to see an extra year or two that's built out for research for their residents. So it's just
Okay.
something to keep in mind.
So even by U.S. standards, it seems like within about 8 years, you're going to come out with a surgery residency with specialization in plastic and reconstructive surgery. So that seems like, quite an achievement, even by any standards.
Uh, yeah, I mean, I think about it. It's a long road.
Hmm.
I was saying earlier, and across the board, no matter where you did your medical school training and you did your undergraduate, and where you want to get, and even in just general surgery, if you were to pursue that, 5 or 6 years is a long way, but at the end of it, when it's all said and done after 8 years, I will take my boards in plastics and reconstructive surgery, and and that will be the end of my training
Okay.
from a residency standpoint. So yeah.
Got it. And another question I keep getting from students a lot is, I don't want to go through this residency process and then a fellowship after that, because I cannot be, not making that little money for this long. So would you give us a little bit of a idea that once you finish your residency, we kind of know, residencies typically pay between 50 to 80,000 depending on the region and the hospital. But do fellowships pay more or pay less, or like what's the situation? Is that truly the same continuum? Because that's what students treat it as, like residency and then fellowship. It's the same continuum. Is that true?
Yeah, I think, to be honest with you, I think you kind of hit the nail on the head. Th- that's generally how it works.
Okay.
What happens is, if you want to just kind of term the years, and it works across the board for all residencies as like a PGY1,
Mm-hmm.
PGY2, meaning postgrad year one, postgrad
Right.
year two. As you work your way up through residency, you're exactly right. I mean, a range that seems pretty reasonable, 50 to 80,000 or so. And as you work your way up through residency and then transition into a fellowship per se, the wages and the salary is pretty comparable. It doesn't
Okay.
shift markedly, and you shouldn't anticipate really a lower wage than what you previously were in training. But like you said, you were exactly right. Depending on where you are in region and hospital system and what they can pay their residents varies. And what medical students and residents are saying to you and what you're hearing about those concerns, those are legitimate concerns. I mean, there is no doubt about
Right.
that. It's 2022 and inflation continues to rise. We're not going to bring an economic halt here to our podcast, but you are very right, and those are
Okay.
legitimate concerns. But you figure out ways, to get yourself, situated and put yourself in a position where when you finish, it will be it will be worth it. So
Right. So in that vein, do you think that once you finished a fellowship after post residency, the demand for that sort of a specialized doctor, in your case, obviously it's plastic surgery, it's very apparent. But if it's a different fellowship, like something that's probably a little more general, or something that might be differently specialized, like sports medicine, in those situations, are those particular positions compensated for the extra time that they are spending studying? For example, what I mean by that is, can you expect post residency a doctor to get, say, 30-40% more than a non-fellowship doctor? Would that be fair to say, or what is your thought?
I think, in looking at the numbers, percentage wise, I'm not sure,
Mm-hmm.
but certainly, and I think deservingly so, pursuing a subspecialty. For instance, a really good example, I have some friends when I was in surgery residency that were internal medicine residents that
Mm-hmm.
went into gastroenterology and
Okay.
cardiology. Those are excellent subspecialties, so
Right.
important. You pick a place, they need a cardiologist, they need a
Right.
gastroenterologist, and they are compensated, at a higher rate, and rightfully so. And
Right.
that training, is kind of reflected in that. But I'll say it, and attendings have told me, and even just friends and people talk about it. If it's for a financial reason, or you're doing it because at the end of it, when it's all said and done, it's this much compensation, maybe that's not the right reason, and maybe there's other routes and other things that you can find that you'll still stay engaged and enjoy it if it's just for that sole reason.
I
So
got you.
yeah.
Interesting. So, you know, just based off of your background and your scores and your grades, we were all very curious to know, why did you choose St. James? Was there anything particularly that attracted you right when you started your med school journey?
Yeah. Um, so, it kind of, it's funny. I was thinking about that. I had seen that question, and was thinking about it, and it, looking back on it, I mean, who would not necessarily want to go to an island to be able to be in an absolutely, postcard picturesque setting, and at the same time be, working their way towards, a medical degree. And that was kind of what popped up as the obvious for me. But the real truth of and how things kind of worked out and unfolded for me was, after I finished my undergraduate at University of Vermont, I spent a couple
Mm-hmm.
years off and I moved to Colorado. And I just took some time off. I did not score very well on my MCAT.
Mm-hmm.
And I wasn't super excited with my score, nor did I think it was competitive. So I started thinking about some other options, and also where I could kind of sooner rather than later, meaning not have to wait an entire another
Mm-hmm.
calendar year to go for medical school. And so I had applied to some of the Caribbean medical schools, and St. James got back to me very quickly. I sent a CV and spoke with an admissions director and kind of got some information down, and it was a quick enough turnaround and enough to kind of see the amount of interest they had in me as a potential student, and the interest I had in them, to come down to Anguilla and study, and that's kind of where it took off. I think medical school, obviously it's a complete necessity to kind of move forward
Right.
in a career in medicine, but you put the work in, and everyone's studying the same books. It's just how you're being taught and the motivation that you have, and I thought St. James did a great job with that. So
Awesome. Well,
yeah.
so it seems like you also made up your mind as far as surgery is concerned fairly early on in your education. Would that be fair to say?
Sure, yeah.
Okay.
Even when I was in my didactic teaching on the island, I always kind of had a fascination. I really enjoyed our anatomy lab, our physiology teaching. I had a kind of a fascination in a lot of the pathology and those kind of little sidebars in classes where we talk about surgical problems and things like that. Had always kind of caught my eye and my attention. But furthermore, I kind of teed myself up to kind of save the best for last. And when I did my rotations in Chicago, I saved surgery, kind of knowing that it was my highest interest and what I wanted to, from a core rotation standpoint, be, kind of just get the most out of. And I felt like leaving that as my final rotation would give me that opportunity. And I really kind of enjoyed everything that I was able to see from a core rotation, and then going forward, kind of springboarding into some electives. And I was always really fond of surgery just in general, and that kind of aspect of medicine. And though I had really great experiences in my other rotations, and just generally had a very good experience in Chicago, that was what I was most interested in, and what I kind of knew I wanted to pursue from the very start.
Right. So, during your training in medical school, when you were interacting with your other students, did you felt like you have to prepare differently for your tests and your whether they're internal or whether they're board exams? Was there any difference in your preparation? Did you feel like you were working harder than your peers in class?
Not necessarily. We had a really nice class, a really good class, and I still kind of know that a number of them are in great spots right now with
Hmm.
either finished, completed residency
Right.
and are practicing physicians, or currently in residency. And I'm not surprised, but people learn and study differently. And, for me, I'm a very visual learner. So I kind of
Hmm.
early on got into the habit of watching videos and kind of listening to things and watching them. And there is just a myriad resources out there in order to learn, and like we talked about, everyone's kind of learning the same thing, but going about it in different ways. And I don't feel like I prepared any differently down on the islands necessarily. Once I got to Chicago and started preparing, once I was in my rotations for step one and then ultimately step two, I don't know how people were preparing. I just was working extremely hard all the time, whenever I had free time, and just keeping a mind about being ready and prepared for those boards, because I knew that that was what was going to be my opportunity to kind of set me apart from some of the competition. So
Okay. And do you think that if you mentioned you've worked really hard, could you give us like a more objective view of what hard meant? Were you studying 9 hours a day outside your rotations, 5 hours, 6 hours? Do you remember?
Um, let's see. So, objectively, when time on the weekends, in the evenings, when I had free time, especially when I got to rotations, rather than, staying active with with things like hobbies and activities, I kind of was hitting the books and reading and like I said, watching pretty consistently. To set an exact hour on it, gosh, I don't know. I mean, because you get so busy with your clinicals
Right,
and and life's going on too, you got to really
right.
try to set aside and carve out some time. But a few hours here, a few hours there. Down on the island, when we were preparing for our, midterm exams and our final exams and block exams, if I guess that's what they're termed, 3, 4, 5 hours. And also, it helped me, and it was a really good experience. I studied with a lot of my friends down there, and we
Okay,
kind of studied together and put together study groups. And I think that that's a great way to just stay motivated is another
right,
thing,
right,
because
right,
you can get kind of lost and a little bit, you can kind of fall off the trail a little if you don't have
right.
some other classmates to help you and to be there with you.
Oh, that's a very good point. So the reason I bring this up is because recently I had read an article by the AAMC which said that most U.S. students, obviously AAMC focuses on U.S. students, um, before their step one, they study about 9 to 12 hours at an average. And I actually mentioned this to some of our current students, and they were like really surprised. They're like, "What? Wow, that's a long time of studying." I was like, "Yeah, I mean, but that's what doctors do, irrespective of specialization. That's just how hard the USMLEs are, and if you want to do well, that's how much you have to study." So I just wanted your perspective on how much. And it sounds like when you're on the island, you have classwork. Our class is about at least 7 hours a day, and you were putting in about 5 more. So in total, you're studying about 12 hours a day from the sound of it before your step one.
Yeah, and I mean, when I was in Chicago preparing for step one, and when you kind of talked about that a little bit, those numbers, it kind
Mhm.
of jogged my memory a little bit. And I don't think that you're wrong in terms of that estimation. I mean, I would say maybe a good 8 hours or so a day that was just carved out, whether it be to do questions, to
Oh,
read,
okay.
to read, to watch videos, and to really kind of try to put it all together, because it's just so important. It really is. And a lot of that, you've been kind of given all the pieces, and you got to just kind of do it yourself and kind of be ready then. And that onus is kind of on us as the medical students once we've gone through the rotations and are ready to take the boards. So.
Okay. So at which point in your education did you actually switch gears and was like, okay, you know what? I am going to focus entirely on surgery and I want to become a surgeon. At which point did that occur? Were you like, when you took your step one, were you still in two minds about potentially, going into some other specialty? Or did you know right from MD1 that, hey, I'm a surgeon or bust?
um, that's a good question. I'm a pretty open-minded guy.
Hmm.
Am, and I've really enjoyed everything, like I told you before, and kind of learning whatever we can. But early on in medical school, I was certainly interested in surgery, but I knew that there is a little bit of an uphill battle, and it's a tough road for an IMG to take that path. And that
Right.
was always in the back of my mind. But um, it was really when I got to my clinical rotations and kind of completed the first portion of didactics on the island that I was really motivated, and clearly that was the path I wanted to take. And basically, my thought was, I'm going to do the best that I can on step one, see where that takes me, get as many opportunities as I can from surgical rotations, and pursue that path. And so, you could say maybe even when I started med school, that's when I really thought about it. But it wasn't until really rotations that I knew that was exactly where I wanted to go.
Oh, so this is really good news for a lot of our students. It's not like you have to come in with the mindset that I'm going to be a surgeon.
No.
It's something that can potentially form and develop as the time goes on, and then especially right around step one, which is kind of what we also tell students, that once you've taken step one, you should know enough to kind of put a finger on where you want to end up.
I think that is an excellent, take on it, and an excellent thing for, an MS1 coming in to their first year or quarter. Just, be, open-minded, and don't feel like you're tunnel vision to something, because it certainly can change. And I have friends and colleagues that it has, and that's great. That's awesome. So.
Fantastic. So the other question that I had was, and you mentioned this a little bit when you just said that you knew that it was an uphill battle for an IMG to get into surgery. Granted that you probably went through the match process about 5 or 7 years ago. Do you still think that that's the case, or do you think things are changing for the better or worse, or it's getting more restrictive? What's your thought? What are your thoughts on that?
I think that it's changing for the better. I think
Okay.
that I know of a number of IMGs in different residencies here at University of Tennessee, but I had friends that I trained with in general surgery that were IMGs from different
Okay.
Caribbean medical schools, and also from Europe as well. I have a good friend here who's an orthopedic surgery residency colleague that he's from a European med school. But I think it is changing for the better. I think the paradigm is shifting, and I think the hardworking and a little bit of a tougher, kind of uphill battle, it kind of is resounding to these residency directors to know that they're going to get people who are really driven and really motivated to make a splash in residency. I think just in general, IMGs in all residencies across the board, that idea is very well accepted. I think surgery is a little bit kind of slower behind the curve. And I don't know for what that reason exactly is, maybe just traditionalism, or just, it's just generally, it's a little bit more competitive. But overall, I think that it's really, it's for the better. And I think as an IMG with an opportunity at any one of these schools, or to come here for a residency, you have a great potential and great opportunity to match, regardless of what you want it to be.
Right. So after you actually matched into a surgery rotation, did you feel like there was any prejudice against you because you were an IMG, or is it a completely level playing field and everybody starts from ground zero?
I sought out a residency program that I knew was IMG friendly, and I really got a good vibe from them, and I really liked the program director, and I kind of was seeking general surgery residencies kind of across the Northeast and the Eastern area of the U.S., which is kind of where I'm from originally, that had IMGs on their residency board or what have you. And I wanted to see that was an opportunity. And so at my institution, and we also did some rotations at some other institutions in order to fulfill our, ACGME credentials. I didn't feel like once I arrived there was any prejudice, or that there was any real kind of any difference. I can't speak for other people, but here at University of Tennessee, because it all kind of comes and stems back from my St. James graduation, I don't feel that at all. As a part of the plastic surgery fellows, there's 5 of us, and we're at varying years. And from my attendings, as well as from other attendings on other services, and additionally with other residents, the only time it would ever come up is if I brought it up and they asked me, "Oh my gosh, what's that like? How was that? That must have been awesome. How did you get here? How did you get here?" And it's like, that's fantastic. So
it seems like, most of your colleagues are particularly intrigued about your experience as an IMG, in a very positive way, as opposed to being quote unquote condescending, so to speak. Is that fair to say?
Yeah, I would, and I don't I don't want to speak out of turn for other
Right.
places and set the tone that this
Right.
doesn't occur, because it very well could. But at the institutions that I visited when I was a general surgery resident, as well as the institution that I worked at and was constantly a part of, and now where I am as a fellow, it's more of an interest, and people are on a level playing field, and it's a, hey, how did this you come about this, and how did you find out about us, and they want to know how the experience was, and how that goes. And it's a pleasant collegial working environment, and
Right. Right.
I don't anticipate going forward that really should change. And in fact, I think with knowing how many IMGs are here in the family and the internal and the pediatric residencies, how many IMGs are present, that it should just only continue to improve.
Okay. So this is very interesting, and especially now that this is residency season, we've done a lot of podcasts around interviewing and things like that. A lot of our students and alumni are actually program directors right now,
Yeah.
and I keep telling students that a lot of students are mentally like, oh, I went to a Caribbean medical school. As a result, I am at a disadvantage. But from what you say, it almost sounds like it really depends on how you look at it. And in your situation, this was almost an advantage to you in the sense that, hey, I had a very different experience because I went to a place that's not in the United States and I didn't have a standardized experience. And you used that and you portrayed that as your strength. So would that, and then that's what we keep telling our students all the time, that, hey, it can be a strength or a weakness, depends on your perspective. So when you present that, definitely talk about the unique experiences of sitting on the beach and studying. The fact that you literally did not have a choice but to study because there's no movie theaters on or
Yeah.
something like that. Is that something that you actually were they curious about that? Because I know for a lot of Americans to say that, hey, I went to a country that didn't have a movie theater is just mind blowing.
Yeah, I mean, Angola was fantastic, and by no means, don't get me wrong. We had plenty of fun, and I met
Right.
some great people, and we really enjoyed the island. And I'm just so grateful for that opportunity and that experience. And we were always active and having a great time. But yeah, I mean, it does kind of bring some intrigue and interest to people I talk to, and they want to know about it and hear about it. I've had parents ask me about, hey, we know you went to a Caribbean medical school. Our daughter or son is considering it. What are your thoughts? And it's nothing but positivity. And I think you could say that maybe there is a little bit of a disadvantage because it does come across
Mm-hmm.
on your CV and on your application, and there is no doubt that there are program directors and there are programs that aren't necessarily going to even give you a chance for an interview, but all it takes is one interview.
Right.
And all it just takes is just to kind of set yourself apart in X, Y, or Z, and give yourself an opportunity. And if you have that confidence and that pride in where you came from a medical school standpoint, and what you have to offer to them, I think that's all you need. And again, reiterating, my program director was very upfront and very forward about his interest and his liking to IMGs as his residents, and it worked out great. And
That's awesome.
I still speak and am close to him to this day, as well as most of the other attendings. But you got to do your homework a little bit and kind of
Right.
figure things out, and you just know that sometimes, yeah, maybe you are going up against a stiff competition, but it's it doesn't mean that you can't get a foot in the door there, really.
Right.
So
But it seems like the stiff competition is not just for IMGs; it's across the board. Surgery is one of the
oh,
most competitive specializations.
Absolutely. It is. It's across the board, and a
Right.
lot of applications go out, and a fair number of people go unmatched. But
Okay.
that doesn't mean it's the end of the road. And that's another thing. I was lucky enough and grateful enough to match my first round, and it certainly makes things a little more difficult. But across the board, surgery is very competitive. But I
Right.
don't think that should necessarily deter anyone
Okay.
who is listening to us or who has any thoughts about it. Don't let that deter you. Kind of take on the challenge and embrace it. And if that's really what you want to do, you try to get it done.
Okay. So I know I'm going to latch on to a term that you use that make yourself stand out. You mentioned that beyond test scores, how would a student make themselves stand out when it comes to interviewing for a surgery residency or even on their CV? What can they do to say
Yeah.
catch your attention potentially?
Oh, I mean, going to that place, if you can get it done to do a rotation or a visit or spend a little time,
Mm,
goes uh, above and beyond anything else on that CV. Because if they can see the person you are, and can get to know who you are over a couple weeks and just see your work ethic and put kind of a face to the name, and a personality to the name, that speaks volumes. And even at my uh, fellowship, which we get visiting residents or medical students, it goes a long, long way. And I think that's probably my number one recommendation to med students, if they have the chance and they're able to do an elective or even just a visit somewhere for a couple weeks or a week or so, be seen. You know, Having strong letters of recommendation, I think that really does help. I think that's
okay.
good, and most program directors will kind of take a look at them and see, and they'll see that people speak pretty highly of you. But I think above and beyond all that, and kind of push the test scores aside, research aside, letters of rec aside, if you can, you know somebody or meet somebody or spend a little bit of time with them, it's going to be the ultimate kind of goal, really.
Awesome. So this is interesting because we actually did a podcast with Dr. Tarabi, one of our students who matched last year, and she applied to a surprisingly very very small number of programs, which is not typically what we see from students.
Yeah.
And we asked her, like, how did you manage? And she practically got an interview from every single program that she applied to. And she kind of said the exact same thing that you just reiterated, where she mentioned that her fourth year rotation, she actually went and tried to rotate with the program director whenever she could. And those are the programs she only applied to. She didn't really blindly blanket apply to any random program just because, for whatever reason, they're IMG friendly or what have you. But she knew people within the program. These are people that she actually physically worked with, and they knew her. So they knew that they were applying. And then she actually got an interview with almost every single place that she interviewed at. So it kind of goes to show that your advice is also across the board with other specialties. She got into OBGYN, which is also not family medicine or internal medicine, which is most of our graduates get into that. But it seems like if there's a will, there's definitely a way to get it done. And it's just personal, um, you know, interaction that really matters. But one follow-up question to that is so if you get, say, if you have a failure in step one, or step two, CK, does that discount you from becoming a surgeon entirely, or do you think that there's still chances of redeeming yourself?
That's a tough question, because in what I know it's going to make it more challenging.
Hmm.
I know that it's going to be a difficult path, but I wouldn't say that it's impossible. I think that there are a lot of guys, and girls out there who maybe aren't great test takers, and maybe had a bad day, or maybe things didn't go well. And there are ways that you can kind of, show that you can improve, or that you can make it better. But surgery is difficult. If there is a failure there, it is going to be a challenge, but I don't think that it's impossible. And I don't think that a program director, if there was a lot of good things to show on your CV and your application, and there was a lot of good bright kind of shining stars, that they would totally discount you and say this is the end of the road, if there was a failure somewhere along the way. I don't know, specifically, what the numbers are for that, and kind of how it goes. But no, I would say, to at least, try to see and test the waters, and see if you want to make that application, to give it a try. So.
Awesome. So I had a question. This is my question as an institute for St. James. What can we as a school do to increase the interest of our students to get into surgery residencies? Is there something that the school institutionally can potentially do?
There are opportunities throughout the year that are meetings, national and international meetings, that if there are med students that are interested, if St. James, if they have something to either potentially present as med students, which surgical meetings and plastic surgical meetings always have med student presentation rooms.
Okay.
Giving them that opportunity, that goes miles to be able to network and meet people, and get a good idea of what things are like, and giving that opportunity to students that maybe prospectively would like to be a part of the surgical community would be a great thing. And outreach to alumni, I mean, as me myself coming from St. James, I'm more than happy to field questions, if people want to know, to have that kind of networking and kind of mentorship availability to students, I think goes a long way, because just knowing from real world situations how things work can kind of give you some insight, and just kind of a reality to how it goes.
Awesome. Well, I mean, thank you so much, Dr. Kimmel. I think, one final question. We've gotten a lot of that from a lot of students when we mentioned that we were going to be interviewing you. And they're very curious to know, you mentioned that during your education, you've kind of put your hobbies aside. Now that you're seeing light at the end of the tunnel, what are your hobbies and what do you do in your free time?
Okay, so it's funny you say that. So I'm married. I have 2 daughters, and I have a little boy on the way in a couple months. So my family is obviously pretty important to me, and my wife she's such a good sport. She's been along the way and been supportive throughout this thing. But I absolutely love to golf. I've been a golfer for years and years. So when I have some time to go out, I golf. I've been in a fantasy football league with friends from college for the last, I guess now it would be like 12 years. So that takes up a little bit of my extra time. And I love to run, and my wife's a runner, so she kind of got me into it. So we kind of bond over that. And now that we're down in Tennessee, there's a lot of good hikes, so we kind of stay busy with that and keep our girls busy. But if in terms of my hobbies and activities, first and foremost now are my 2 daughters. They're 6 and 4, and they kind of keep up my time whenever I have some free time. But when I was on the island, and when I was in Chicago, my gosh, we loved playing beach volleyball. I loved going to the beach and paddleboarding. In Chicago, I would go out and see some live music. It was always fun to try new restaurants and just enjoy the city life too. So I mean, I feel like I'm a pretty active person, and when I get down to it, I can definitely have some fun too. So
okay, awesome. Well, thank you so much, Dr. Kimmel. We really appreciate your time. And as does St. James, I think this exposure that you're giving our students is fantastic. It means a lot to them, because I don't know I mentioned this, but only about 2 to 3% of our students have matched into or choose to go into our surgery residencies. So you're definitely, from our standpoint, the exposure that you're giving our students is truly amazing. Well, thank you so much.
Thank you so much for tuning into our show. We hope you enjoyed another episode of Med School Minutes. If you like our content, please follow us and receive notification when a new show is posted. This podcast is brought to you by St. James School of Medicine. For a video version of this podcast, please check us out on sjsm.org/video.